Hey, I'm Sebastian. I'm going to talk to you about SI joint pain today, or pain right around this area. I'll show you myself just so you get a good idea about whether you're in the right spot or not. So usually the way you can find the SI joint here is if I were to just put my hands kind of on my back there and just slowly bend forward, you start to slide your hands down and you get two little bumps right there, and that's the SI joints. SI joints right there, and then off to the side is gluteal musculature. There's the low back muscles up here. All of those can hurt with SI joint regional pain, and I'm going to show you today what's going on, what are some possible diagnoses, how to logically kind of self-test them out, and a few things you can do to get out of pain very quickly. So I encourage you to stay tuned through the entire video. Many of you will ask in the comment box, which we do encourage you to ask questions, but if you ask about what happens next, what to do next, stay tuned to the very end of the guides. We're going to have a gift for you and basically an outline of what you should do next. Okay, we want you to be able to follow this path to get out of this, but many people, when they watch this single video, it's good information, but at the same time, it won't get you anywhere long term, all right? It will reduce pain though. I know it's important to everybody. So when we go through this, we're first going to go through anatomy. If you want to scroll through and get to a part where I'm moving around a little bit, you'll probably see the exercises in there, but education comes first, guys, so it's best to educate yourself about what's going on with your body, okay? And so I'm going to use three different spine models for this just because they have different characteristics with this. This one has nice colors, so it's cool, all right? And so this is the pelvis, all right? And the SI joint is actually accumulation where this blue or purple, I can't tell, I'm colorblind, bone comes in with the white one, and so it's the area, the junction in there is called the SI joint. We can see it has a partner over there, all right? It's evil twin on the other side. And from this side, we can see it's from the front side here. It's important to note that if you have inflammation in the SI joint, you could have something that needs to be managed by a rheumatologist. And if it's a consistent slow burn, like it's always painful all the time, sometimes there's oddball things that can happen, so a rheumatologist and a blood panel work might be helpful for that. However, if it kind of comes and goes and up and down and worse with bending forward and walking and sitting and getting up from a chair, those are circumstantial ones, and we have kind of ebb and flow. And so that's a good, if you have that, it means that there's a lot of mechanical things we can do to get rid of this versus just taking medication and surgery. By the way, it's important to note, to this date, I've been in practice for 12 years. I've never, ever, ever had to send anyone out for an SI joint surgery, ever. There's certain circumstances where that might be helpful, and injections within the area and so on, but I'll tell you, I've seen a lot of people with SI joint regional pain, back pain, hip pain, have not had to send one single person out for SI joint surgery, okay? You're a rare case if you have to get that far. So please, if you're thinking that, and if you have questions for us, we encourage you to ask us questions. So this is the basic anatomy of the SI joint. However, the SI joint, I'll use this model. This one's sloppy, same color, but at least it moves. Okay, the SI joint, if we take a peek in there, and I'll kind of hug cradle this thing, you can see that it moves a little bit. And so the movement or shear that happens within this area is dependent upon not only what this bone is doing, but what this bone is doing. And so if you don't have good musculature around it too, I'll flip the guy over, there's muscles that cross this area, such as the piriformis. It goes here from the hip bone all the way over into the front side. We have the glute max, which is a big muscle which crosses here. We have the little glute muscles. We have the lats that come down. We have the paraspinal muscles from the back that come down. We have a bunch of musculature that comes down and attaches within this area. And when they do a good job together, they do something called co-contraction. They stiffen it. Okay, they keep it packed together. And what we know from the function of the SI joint is that it's like it should be able to bear weight. All right, I'll show you this on the next spine model, what I'm talking about here. And every time we take a step, let's just say if this guy, he's only using one leg right now, he's standing on this one leg. So all this load of body weight and gravity is going through this joint, which has to have integrity within this joint, which then has to then carry over to the rest of the body. Good job. That hand's always in the way. So the ability to use this entire quarter, including the glute muscles and the glute med and the piriformis and the hamstrings and the quads and the musculature of the core, is so important to this that if you do not address these areas before going through something like surgery or medication, you're missing out on easy wins. Okay? I don't have a model which has all the musculature in it, and I know it's very easy to be distracted and only look at the bones. Rarely is it the SI joint that's the issue. Why am I doing a video on SI joint pain? Well, because you can have pain there without having the SI joint as the problem. I'll give you some examples. A disc, a low back disc, which is, I'll move his arm again, which is the red there, a low back disc herniation can refer pain to the SI joint. It can refer pain directly onto that bone that if you touch it, it hurts every single time. It can feel like the SI joint. It can feel like it's down into here. It can go into the glutes. It can go into the leg. It still could be referred from a low back disc herniation. It can also be referred from these little yellow things called the spinal nerve roots, which again can create pain into the area. All right. Granted, it could be the SI joint, but I'll tell you a couple characteristics that will give you a good idea whether it's SI joint beyond reasonable doubt or not. However, if we're talking about rough percentages, if we see someone come in with SI joint pain, most of the time, I'm going to say 80% of the time, 90% of the time or more, probably more, it's going to be from the disc or the nerve of the back. Okay? Again, I had to do a presentation recently. I asked a friend, he's been in practice for 6 years. I said, what does an SI joint strain look like to you? And he's like, honestly, I've only seen one. And I was like, I've only seen one. It's not that they're out there, they're just rare. And here's how you can differentiate them a little bit. Okay? The first thing is, I'm gonna sit in this chair here, and I'm just gonna bend my back forward like this. And I'll turn over to the side just so you can see. If you're seated here and your SI joint hurts and bending your back forward hurts it more, this does not change the strain and shear force on the SI joint enough to piss off the SI joint. What this does is it changes the spine. And so if this creates more pain to the SI joint because of a positional change with the spine, this is probably not an SI joint. It's probably not an SI joint. You can have pain there, but it's referred from the spine. And if you treat it like a spine in a conservative way with doing exercises that are specific to the spine, some core endurance, some first aids, which I'll show you in a little bit, then you're going to get where you want to go. Another thing is if you go big like this, big posture, this might increase it. Again, this doesn't create an appreciable amount of shear on the SI joint to create SI joint pain. Now there is one circumstance, and I want to be careful saying this because some of you will have pain with this even if you have the other two issues, is it's a split squat or walking. A lot of times, so there's more shear force on the SI joint with a split squat, which is like this, or walking, which again could cause enough shear force to create an SI joint strain or to trigger a strain and lead us to a diagnosis of an SI joint strain. But many people with disc and nerves, they can't walk anyways. They're stuck on the ground. I mean, let's be realistic. If you ever threw your back out or if you have any back pain around here associated with that, you're probably dealing with the low back, okay? And I encourage you to treat it out how I'm mentioning it to you today after we get to the demonstration here, okay? If these things work for you, then you're in good shape. Having a disc herniation or having something like a nerve issue is not a big deal. It does hurt. It sucks. I've had them too. But just know that you can recover. You don't need surgery. You don't need medication most of the time, a strong majority of the time. You just need to have a good game plan and roadmap. So I'm going to show you part one of the roadmap today, and I'll try to take you through a couple self-tests basically. Again, you should be assessed by a doctor if you want to work with us. We're in Orange County, California. We do have telehealth, and we do have walk-ins. Not walk-ins. You got to come in and see us, okay? We get more information, and we're able to help you out better the more information we can get from you, and that comes in the form of a physical exam. We can do some of it online too. So I'm going to go on the ground and just show you some stuff that usually works. But first we have to test, we call it a movement audit. The movement audit is basically you pick a movement that bothers you. I don't care what it is. Bending forward, bending backwards, shifty, little teapots, little squat down, little turns, whatever it is. It could be doing the hokey pokey, you know, the flip turn. Okay, it can be whatever you want it to be, but you have to come back to it again. And if you get a 30% change in what you feel, or your range of motion changes, after doing this one certain thing, that means you're on the right track. And it's probably not an SI joint strain. Again, I can't diagnose you because I'm not with you, but I'm telling you it's probably not an SI joint strain. It's something in my eye. So We're going to go on the ground here. Here's the first thing. They're called drop downs. And so we're just going to go like this. Okay? There's nothing fancy. I'm going to let gravity do all the work. And I'll pan here just to give my photographer a chance. And all you got to do is just kind of drop, hang, drop, hang, drop, hang. Do 20 to 30 of them, okay? I'm going to let you pause the video and do that, and then come back and we're going to do the hokey pokey again, okay? Once you come up, we're going to try that movement again, whatever it might be, and again, whoa, that feels better, great. Probably not an SI joint. What do you do next? We're going to talk about that later, okay? That's option one. Option two is we're going to do something called, this is like a hip flexor stretch, okay? And so a lot of times people with pain right around here, they'll also have a little bit of flanking into here. Actually, I should probably mention that too. Just because you have pain so if you have pain other spots like tight hamstrings and hip flexors and groin issues and stuff down the side and a little bit of, adductor strain kind of stuff, and you're finding all these different diagnoses, just focus on the main one. A lot of it will just tend to go away, okay? A lot of people will notice after doing these interventions that half their stuff will just go away, okay? And it only takes usually a couple weeks, and then we have to stick it. You have to make it so it stays. So we're just going to do a bunch of reps here. We're going to take the hand right here and just kind of edge into a little bit of a tightness and come out. A little bit of tightness and come out. And we're going to do this about 30 times, okay? I'm not trying to do anything fancy with my upper body. I'm not trying to get big and tall. I'm not trying to make this into a yoga move. All I'm doing is simply just kind of repping out a hip flexor stretch. Now, we're going to notice as we go through a handful of reps, it might tend to settle. You might get through more range. You can push a little bit more with the hand. And we're just going to rock, rock, rock. Even if it's a little uncomfortable, it's not necessarily a bad thing. Once you stop and you kind of shake it out, does it go away? If it goes away, the uncomfortableness goes away, that's okay. All right? If it settles and it stays, that's a whole different story. And obviously these things shouldn't be done if they're painful. But they should go away right after. And so then we're going to test the movement again after you've done about 30 or 40. Okay? And so we're going to up and down and so on and do the hokey pokey and figure out, and wow, that feels way better. Way better. Okay? That's option two. I play baseball, so I do this. Okay? Option three is we call it a 90-90 position. And so I'm going to use this here. I feel like the Predator. No one watched that movie, huh? The photographer didn't watch that movie. So this one's just here. All right? All I'm going to do is just chill out and relax. I might get like a towel and put it under my tailbone, not my sacrum, my tailbone, or just the very back end of like your butt cheeks, and you just kind of let it hang there. It'll eventually round you like that, and you just hang out and breathe and chill. Many people find that this is completely pain-free, and so we call it a position of comfort. Okay? The position of comfort, all it does is it chills everything down. You got to chill it down before you build it up again. And I usually have people spend about 10 minutes a day doing this, break it up into little bits and so on. Again, is it a stretch? No, it just chills it down. Sometimes the easiest one that many people need with SI joint regional pain is that they need to chill everything down. You don't need to stretch it. You don't need to do more exercises immediately. Chill it down, and then we can do a little bit more stuff later, which will be helpful. So again, spend a couple minutes doing this. Just breathe into the hands. Put something on your butt cheeks if you want to kind of let your back sag into the floor, and just relax. And then we're going to do the hokey pokey again. Okay? So test those movements. Wow, way better. So it does happen. It really does happen. I know it's probably some of you will say, hey, that didn't work for me, but it really does happen. But all we're looking for reasonably is a 30% change. 30 meaning, wow, that's surprisingly better, but it doesn't stick. So these things don't stick if you only do a couple of them. You have to do a little bit more of them, usually over the course of about 3 to 5 days. You just do it, 60 to 100 reps for the other ones, and you do about 10 minutes a day broken up for that last one. But you don't pick all three, you just pick one. You pick the one that worked best. And after that, you have to take this into a different arena, which is basically you throw those away, and you have to do something which supports the area. There's one thing I can say with fair certainty. If you only did this, this will come back. This is step one of basically a 4-step process of recovery. We're not going to make this like a 5-hour video, because that's basically what it would be. This is just step one, and it's intended to meet you guys where you're at. If you're having this problem and you feel like there's nothing to do to get rid of it, this is intended to give you a little bit of doubt with that you won't get better. It sounds like if this worked for you, you probably will get better. You just have to have a little bit of guidance and a roadmap. So what we're offering today is basically, we're going to give you a gift, okay? We've changed this gift over time, mainly because we've made better things than we had before, and some were audio, some were webinars, some were books, and some were PDFs and so on. Either way, whatever we're currently doing, because we keep changing it for whatever is best for your consumption, making it easy for you, it's going to be available in the corner. I'm not sure which corner, but it'll probably pop up. Or it'll be in the description. It'll for sure be in the description below. And so it'll be a link. It'll say free option. Okay, click on it. These are for people who just want to explore what's next. They're not quite sure. They're like, hey, this felt better, but I'm really not sure. I'm not sure to really commit, because we'd like to see you in person. We'd love to see you in person, but not everybody's ready for that jump, and that's okay. All right, so that's option one, the free thing. Option two is we do have paid online products. They're as low as 20 bucks, okay? Everybody's got 20 bucks US, all right? And I'm sure you spent more on your copays for your doctors for 20 bucks. I mean, I think I spent 20 bucks on beer like a couple months ago, you know? So make sure that you save your money and buy that if you want something more focused, okay? Option one is great, but option two is more focused. Everybody likes more focused. But if you want custom, you should work with us. Okay. Option three is just work with us. All the links are going to be below. Option one is below. Option two is below. Option three is below. Okay. If you want to work with us, there's many different ways we can do this. If you're in Orange County, California, we are here. We're taking patients. We're open. And if you're not around, just reach out to us anyways. Just email us, info@p2sportscare.com. There are ways that we can help you virtually. Or just call us, 714-502-4243. And we'll get you set out on that path. It all starts with a movement assessment. If you really want to get better, you need a custom plan. You need to do something custom. Everybody's a little bit different. I'd love to say all the cookie cutter stuff is going to work, but at the same time, there's going to be fallout. There's going to be people who are doing it poorly at home. Maybe it's not right for them. Most people don't get worse. They just won't get better if it's not going to work for them. But I'd say at least half the people are going to really improve from the free option, but especially the paid. But if you want something unique to you, I know a lot of people want custom stuff, just email us, info@p2sportscare.com, or call us 714-502-4243. We'd love to help you out. The best possible thing is in person. So if you're dealing with this and nobody's been able to help you yet, and you feel like there's nothing you can do for it, you're always in pain, and you feel like surgery's on its way, we're right here. Just email us, just call us. We're here to help. I think we're good at what we're doing, and we're honest too. So if you're looking for more free stuff too, there is stuff on YouTube, but again, go custom. If you're my sister or brother, I'd just say go custom, just come in. Nothing like in person. Talk to you soon.